Sir, one more thing we have to discuss is about choking. So, choking can be elderly or of any age. So,
Okay.
when someone is choking, how to identify he is choking and what is the way to bring him out of choking?
Okay. So choking is also very common, especially in small infants and kids where they feed when they are lying down position. And as I told you, it's all depends on the anatomy, so our body, how it is. So nose, throat, and then lungs. This is the airway. Mouth, throat, again esophagus. This is the food pipe, footway. Air pipe and windpipe and foot pipe. It's easy to identify. Now, when it is up and it is low here, when it goes again, windpipe is above and this is below. That means they cross each other in the back of the throat. Now what happens? Air going into the foot pipe is okay, but food and water going into the windpipe is what choking is. That means when here where the foot pipe is very small, you take a big chunk of non-vegetarian or fish or something or a food particles which is going into the lungs. If it is a small which is already passed and goes to the lungs, it's called aspiration, but which is obstructed here is called choking. That's what choking means. Okay, so when choking happens, how do we know is what we are. The person is able to bigger adult is able to tell or to what he says, he'll put his hands like this and that means he's choking. Then we have to ask him, are you choking? Then they'll nod, they can't answer because voice doesn't come if it is choking. So they'll answer yes, like this they'll nod. So that is when you know that the person is choking. For infants, small babies, where they can't talk or do two things, they'll start becoming blue. They'll stop breathing, they'll grunt. This kind of sound comes and they start turning into blue.
Okay.
That's why you don't feed people in dark.
Okay.
You should feed people, kids or someone in the very lit room because you know what they are eating and how they are when they are eating. Especially feeding is never done when it is dark. Even when you are breastfeeding the baby, during sleep, they sleep beside the baby and they give breastfeed. This is very wrong. Switch on the lights, sit, make the baby in 15 to 30 degrees angle and then feed the baby. In this way, you prevent aspiration and choking. Okay. So choking, what happens when it happens to the choking? If it is the baby, sir, which can be held in the hand, you hold the baby in the hand like this and then you can give in the front, you can just press like a CPR. You can press the baby 5 times here and then you can turn the baby back and then you blow the back here 5 times. In this way, whatever is obstructed in this, it will come out.
CPR in the same place
where we do
between
yes,
sternum
on the sternum, lower half of the sternum between the nipple line and the midline.
How many strokes?
5, sir.
5 strokes.
5 compressions and 5 strokes at the back.
Okay.
If you do compressions and back, if you do like this, usually that comes out.
Okay.
Okay. For adults, so if you stand, will show. Yeah. So, sir, you put your hands like this. Hands like this. Sir, are you choking? Yeah. No sound, only that. Yeah. Sir, are you choking? Yeah. Now he is choking. So I have to stand behind him. Okay. So I have to lift the hands like this. I'll put the patient's leg little far away here. So it's a stand-at-ease position, not attention position. Stand-at-ease position, and one of my leg will be in between the patient's leg like this, and then support the patient with my body like this. Okay. In that way, if he becomes unconscious, he will fall on me rather than we both fall down. Okay. Now with one hand, I will make a fist like this, and here below the sternum, below the rib cage here, point out the rib cage here. This fist goes here like this, and the other hand will go and push the fist up like this. Okay, so here it goes up. So the pressure comes like this, up, up. So the minute you start doing this very hard, whatever is in the throat will come out because of the pressure. This is called Heimlich's maneuver. Okay. If the person is adult like sir, same height and same thing, you can do it this way. If the person is small child, this much height, you can kneel down behind the child and can use only one hand to give the thrust. So in that way, whatever is obstructed in the throat will come out. So during this one, if there's a bigger one is obstructed very hard and it's not coming out, then the patient stops breathing, right? There is no oxygen. So he becomes unconscious like this. If he becomes unconscious, what will you do, sir? Same. Like you make him flat, and what we did for unconscious patient there, do CPR, check pulse and breathing, do CPR, and then whenever you are before giving breath, open the mouth and see if you can see. If you can see, remove it. If you don't see, just leave it. Then do CPR. That's all.
Okay. Nothing and how many thrushes is there any?
No limit, sir. As long as it comes out, it can do it, sir.
Okay.
Okay, not on the rib cage, below the rib cage, just when if you
Below
can
the
palpate the
sternum.
when you palpate the bone like this, if you do it come down, you will see a dip, sudden
Right.
dip with the edge of the bone. Below that you have put.
Yeah, just below the xiphi
Yes,
sternum.
in between umbilicus and the bone, you have to put your hand and then do it. That is choking. As I told earlier, knowing them. So the way I explained to you is first why it causes, what happens it causes, how to identify it, and what to do in such instances, and what is the treatment to it. So for anything which you want in a medical way, this is the way you need to understand it. The minute you understand it, you know where to go, whom to approach, and what. So instead of going to many doctors also, if you understand the problem, it's very easy for you to approach an appropriate person. And during emergencies, always think of the life threatening first. That means in a chest pain, example in a chest pain, I always my as an emergency patient, my brain always go to heart attack because that cannot be taken back. If that is the real scenario, and if I don't give appropriate concentration on that, and the patient dies, I cannot take it back. But if it is not, it's still okay for me. I am happy that patient is not having a heart attack, and I can prove it that it is not a heart attack, and still he is okay. So always, if you have a problem, think of the emergency life threatening first. Once if you think of the life threatening, get it ruled out, and then the common things can be treated anyway.
Yeah.
So that is
false positive is better than a false negative.
Yes, sir. Yes.
Thank you very much for your time, sir.
Thank you so much for giving the opportunity, sir. Bharadwaz, sir, thank you so much for giving this. And if you have any more sessions, we can do much more in this. In this session, we can educate the people more.
Yeah. What we ask our audience is go through the episode, and if you have any questions, let us know in the comments, and sir will be addressing the comments in our next meeting. Thank you very much.
Thank you so much.